Hello everybody and welcome to this module on glaucoma. My name is Zakir Hussain. I'm a fourth year MBBS medical student at Liaquat University of Medical Arts and Jamshedpur. Before we talk about glaucoma, let's a little bit talk about the aqueous humor. Aqueous humor is a fluid that's present in the anterior and the posterior chamber of the eye. Most of the students confuse the aqueous humor with the vitreous humor, but note that the vitreous humor is present in the posterior part of the eye. Here is the diagram which shows the angle and the passage pathway of the aqueous humor. Here we have the ciliary muscle. The epithelial cells of the ciliary muscle produce the aqueous humor, and from posterior chamber it flows through the pupil and it comes to the anterior chamber. From there, from the tubercular network, it flows to the canal of Schlemm and so on. Intraocular pressure is measured by the tonometry and it's determined by the amount of aqueous humor produced. Here we can see that the autonomic nervous system plays an important role in production of the intraocular pressure and its drainage. Parasympathetic system plays an important role in its fluid drainage and decreases the pressure, while sympathetic nervous system produces more fluid. But we know that the parasympathetic nervous system allows us to focus during the fight and flight response. But the more the fluid builds, the more the fluid is there, more the pressure develops. Glaucoma, many students usually say, we have the idea that it's a high intraocular pressure. It's associated with the high intraocular pressure, but not always. It results in the optic neuropathy. Visual loss is there, and the pattern of visual loss is peripheral first and then the central. We have usually two types of the glaucoma, the open angle and the closed angle. Here is a diagram which shows the angle of the eye. What's the angle of the eye? It's from the iris and the cornea. We can also say the iridocorneal angle. On the left side of the screen, angle is normal, that's open. On the left side on the right side of the screen, you can see that angle is closed. The intraocular pressure increased and associated with the normal eye, we can say there is an open angle glaucoma, and that with the associated with the closed eye, with the closed angle glaucoma or angle closure glaucoma. In the closed angle glaucoma, angle is suddenly closed and there is a abrupt onset of the symptoms like the red painful eye, blurred vision with the halos, eye feels firm and rock hard. Symptoms of in the closed angle glaucoma are usually triggered when the pupil dilates. We know that the pupil dilates when we enter in a dark area. We are in a stress. Drugs which dilate the pupil have also this side effect. These drugs are like the scorpion and atropine, and it's an ophthalmic emergency. In the treatment of the open angle glaucoma, the definitive treatment is eye surgery, but the different groups of the drugs are used like the beta blockers, muscarinic agonists, osmotic diuretics, and the carbonic anhydrase inhibitors. In the closed angle glaucoma, there is a chronic angle closure. A chronic angle closure portion of the angle is blocked, which develops as scarring. Over the time, angle progressively is more closed, but in this, there is not that much high increased pressure. That's why the fewer symptoms develop, and there is a delayed presentation, and more damage to the optic nerve occurs. Diagnosis made when the peripheral vein loss occurs. Open angle glaucoma is a chronic one and the most common type. No symptoms appear until the loss of eyesight occurs. Peripheral loss occurs first, then the central one. And there is either overproduction in the fluid or the decreased drainage. Angle for drainage is of fluid is open, and this angle is for drainage is open. There's too much fluid or too little drainage. Too much fluid or too little drainage. It means that there either is a increased production or there is a decreased drainage. Patients of the open angle glaucoma are usually kept on a chronic drug therapy. When we talk about the associations, age is usually adult patients are usually have increased risk for opening with glaucoma. There is also a link with the family history and the African American race. Causes, primary cause is usually unclear. Secondary, in the secondary causes, uveitis stays at the first position. Trauma can be there. Steroids, but the mechanism it's not clear for the steroids how they cause the open glaucoma. Retinopathy is also associated with secondary glaucoma. At the fundoscopy examination, you can see on the right side there is a cupping of the disc. Normally it's the 1/3 of the optic disc, but in this picture you can see there is a full cupping of the disc. Chronic glaucoma drugs like muscarinic agonists, alpha 2 agonists, beta blockers, prostaglandin analogs. What does they do? And also carbon anhydrates, which also decrease the senses of production. Prostaglandins also vasodilate the canal of cilium and it is outflow. Alpha 2 agonists block the ciliary epithelium from releasing the aqueous humor. 3 agonists contract the ciliary muscle. Parasympathomimetic drugs like carbachol, pilocarpine contract the ciliary muscle, open trabecular meshwork, and cause the more drainage. They result in the relieving of the symptoms. Alpha agonists like the procoline and bromocorin, they decrease the production, but they have the side effects in the less than 50% of the population. Side effects like the blur, EVN, ocular hyperemia, foreign body sensation, and itchy eyes. Beta blockers, the name are mentioned like the timolol, betaxolol, cortilol. They decrease the aqueous production by ciliary epithelium. Prostaglandin analogs, the leprost family, metoprost, they cause more drainage, but they have the side effect they will darken the iris. Carbonic anhydrase, a diuretic that will decrease the production by the ciliary epithelium of the ciliary decrease production. Finally, we talk a little bit about the epinephrine, which is a mixed alpha and beta agonist. In the early period of the time, it causes aqueous humor production, but in the later periods, it causes vasoconstriction of the ciliary body and cause a decreased production of the humor. But remember that epinephrine is never ever given in the closed angle glaucoma. It gonna worsen the symptoms because it dilates the pupil. With this slide, I conclude my presentation. Hope you liked it. Thank you.